Hi, my name is Siddharth Kale. I'm 40 years of age. I ended up at Pinnacle Orthocare due to a complication that happened in an earlier surgery, and I was diagnosed with a rupture of a tendon in my left index finger. Dr. Parag was very helpful, and we straight away arrived at identifying the injury. Uh, Initial scare was is a surgery required, and Dr. Parag was very helpful in guiding me and not rushing to any conclusions before we did a proper investigation. And only when we were absolutely certain and convinced with the reports did he advise surgery. Once that happened, the administration was informed, and they ensured a very smooth and effortless arrival at the hospital, and like getting admitted and all the other formalities related to the procedure. I was always in touch with Dr. Parag, and he was very reassuring at every point, and he kept me in the loop of what is happening and what is going to happen next. So the duration of my stay was a day, and I was given a discharge the next morning, and it was a effortless procedure, and I just left with a smile in the morning. Thank you.
Hello, my name is Dr. Parag Lad. I am a director and consultant hand surgeon at Pinnacle Ortho Center. Today I am going to discuss a very unique complication or a unique case of a tendon rupture in the hand and wrist. The case was he had a fracture in the wrist, and for which the orthopedic surgeon had put a plate few years back, and Mr. Kale was absolutely asymptomatic for quite a few, many years, but suddenly a month back he got a snapping sound while opening a drawer, and he realized that the index finger tendon, which is responsible for the movement of that finger, was broken at the wrist level. And then he had a very unique complaint of inability to bend only one finger, and other fingers were functioning very well. So we got his sonography and x-ray done, and in that we found the tendon was not only ruptured, but because he waited for more than 2 weeks time to understand the problem and what functional deficit he has, there was a retraction of the tendon. So there was a gap of almost an inch in between the two cut ends of that tendon. So we discussed options, treatment options with him. What is the possibility of, when will he recover, what are the options of surgery, and how much duration he will not be working. And then we got his sonography done from a specialized center, and that also confirmed our diagnosis. The surgery was, we took the spared tendon in his wrist, and that we replace in between the two cut ends of the finger tendon. To our surprise, he behaved extremely well after the surgery from the wound point of view, from the dressing point of view, and from the splint point of view. Today we saw him exactly at 3 weeks of surgery, and he has started achieving some movement in the finger, which is much better. Usually other patients take around 6 to 8 weeks to gain the movement what he is showing today at 3 weeks. He is still recovering, but he has already achieved more than 50% function of the finger. So message here to everyone: if there is any implant or any plate, screws, rod in our hand or wrist, with your doctor's advice, we must consider them removal once the fracture heals, because these rods and plates and screws and wires sometimes cause irritation to the nearby tendons and soft tissues, and such minor complications of tendon rupture or a nerve rupture is very much possible. So please do not neglect any hand complaint, and if you have any functional deficit in the hand, like inability to move, if there is any swelling or uncontrollable pain, please do not hesitate to visit us at Pinnacle Ortho Center. Thank you.